There are some questions we can take it. Yeah, at the outset, I'm not a philosopher, but I guess that's the whole idea of getting people from different backgrounds. So Dr. Sangeeta has been doing this, that to put multiple fields together so that some collective consciousness emerges out of the whole thing. Can I share my screen? Okay. So what I will be speaking today is on distanced self. In the last 3 months, we have heard a lot about the other distancing. Okay, yeah. So in the last 3 months, we have heard a lot about the social distancing. But what I will be doing in the next half an hour or 45 minutes is to speak about the distance self. So we have seen different types of social distancing. So while it's very important, we also have seen a lot of innovative measures to ensure social distancing. Okay, but how is this social distancing related to the distanced self? Okay, so the whole idea of choosing the different dimensions of self in this juncture of COVID has come because of the self-other relationship, I guess. So let me take a different perspective, mainly from a clinical point of view. Okay, so though we discuss self and other as two separate dimensions, it is commonly observed that the distinction between the self and the other is not the boundary is not very rigid. There is a significant influence of what happens in the domain of the other over the self, and at the same time there is a significant influence of what I feel or what I think. Okay, so that will have a significant influence on how I am going to behave or how I am going to interact with the other. Okay, so there is a two-way interaction between the self and the other. So whenever there is a self is isolated from the other, it could have both positive as well as the negative effect. Okay, so the outcome of the social distancing could sometimes be a social isolation. Okay, so in which case you are made to be on your own or just with yourself out of force. Okay, so in which case it may be a negative experience. On the other hand, sometimes I may just want to be just with myself. Okay, so it's more like a solitudeness in which it may be a positive experience. Okay, so the social distancing itself could be of both adaptive as well as maladaptive. Sometimes it may be that somebody is supposed to mix with others, but somebody is not able to mix with others, like we see in social anxiety disorders, in which case it will be a maladaptive scenario. Or it could be an adaptive in which I just want to cocoon myself because I have some important work to complete. So in which case the solitudeness may be an adaptive social isolation. Okay, so the social distancing could be of two ways. So in the same way, the self-distancing also could be both adaptive and maladaptive. We will come to that a little later. So one of the important things which combines this self-other interaction is an interpersonal communication. So for example, if I am speaking to multiple people, okay, so if I'm giving this lecture, what I will be constantly doing is I will be trying to perceive the environment. So if I was giving this lecture in person, I will be trying to see whether all the audience are active. Okay, so I will try to interpret what may be going on in everybody's mind, okay, and then generate a response which may be according to the prevailing mood or according to the prevailing interest at that point of time. Okay, so though I am perceiving and interpreting other person's response, other person's intentions, and generating my own response, at the same time I must be looking back to myself, and I must be perceiving whether I am doing the job correctly or not, and then I have to modulate the response accordingly. Okay, so this is a two-way interaction, okay, which requires both reflecting upon one's own self, how am I doing, at the same time reflecting or trying to interpret the other person. Okay, so how the other person is doing. So this ability is known as something, we call it as metacognition. Okay, so this is thinking about thinking, in which it includes both thinking about one's own thinking as well as thinking about someone else's thinking. Okay, so the fortune tellers are the best examples for this dynamic metacognition. Okay, so they modulate the responses so well that the person who is listening to them, okay, may be showing subtle signs, but the fortune teller actually modulates the responses in such a way that it always pleases, or they will be able to pick up the clues very quickly, and then they will be able to generate an appropriate response. Okay, so they have to modulate both their own responses as well as they have to interpret what's happening in the external world. Okay, so this perceiving, interpreting, and generating responses to the intentions, disposition, and behaviors of oneself and other is the metacognition. Okay, so as I was mentioning, it includes both self-reflection as well as social cognition. Okay, so from a neuroscientific point of view, the neural correlates of both these important cognitive constructs are both distinct and overlapping. Okay, so what I mean by distinct and overlapping is, so on to your left, the PCC, precuneus, and RSC, these are the different brain regions. Okay, if somebody is interested, we can answer that at the end. Okay, so some of these brain regions are purely involved when somebody is involved in self-reflection. Okay, so these brain regions correlates with the self-reflective ability. On the other hand, you have some of the emotional brain regions like amygdala, insula, temporoparietal junction, which are primarily involved in interpreting other person's emotion or other person's thinking. Okay, but there are a few regions like the medial prefrontal cortex, the most anterior part of the brain, or the anterior cingulate cortex, or the superior temporal sulcus, which are involved in both these abilities. Okay, so it is the same regions gets activated when somebody is thinking about one's own thinking. At the same time, they also get activated when somebody is thinking about the other person's thinking. Okay, so this overlap between the social cognition and the self-reflection inside our brain also gives us um, an indication that these two cognitive constructs may not be distinct, but there is a good amount of overlap between the self-reflection and the social cognition, both in terms of the cognitive construct as well as in terms of the biology. Okay, so this is the diagrammatic representation of the brain regions which I was mentioning. So while we are dealing with the social distancing in the real life, okay, self-distancing is something which is not widely spoken about, but at the same time, this is something which we all keep doing. So let us look into what are the different types of self-distancing and what is the importance of self-distancing. Okay, so what is self-distancing? So instead of having a first-person account, if you are starting to reflect upon your own thinking or your own feelings from a third person or a second person account. Okay, so you take a step back and then you reflect on your own behavior, like why am I doing like this? Okay, so instead of thinking like what am I feeling, if you start thinking why am I feeling this? Okay, or whether what I am feeling, is it justified or not, is it valid or not? Okay, so you start looking this from another person's perspective. Okay, so you take a step back and then start doing the self reflection, then that becomes the self distancing. Okay, so in other words, it is the cognitive ability to know oneself. Okay, so instead of just experiencing oneself, you start looking at your own inner self from a reasoning angle. Okay, so you start looking into your own self. The self may include your thinking, it may include your emotions, it may include your behavior. Okay, so when you start reasoning about them rather than just experiencing about those things, then that becomes the self-distancing. Okay, so the self-reflection is a broad term. Okay, so self-distancing is a subcomponent of the self-reflection. Because self-reflection sometimes is adaptive, but at the same time, sometimes it could be maladaptive. Okay, so the best example of a maladaptive self-reflection is a clinical condition known as post-traumatic stress disorder, in which they start reliving the whole experience again and again, and at the same time they start avoiding all the cues which may be relating to the past memory. At the same time, the self-reflection could be adaptive. Okay, so which we will come to that in a little while. Okay, so one best example of maladaptive self-reflection is what we call as self-rumination. Okay, so it's a vicious cycle of thoughts. Okay, so I may start thinking, why did I do something like that? Okay, but then instead of trying to reason out, I become emotional that I did something like that, and I get distressed, and then I get into the same thought that I should not have done like that. Okay, and then it gives back to the same again guilt or a shame feeling, and then I get back to the thought that why did I do like that? Okay, so instead of relieving the stress, it actually exacerbates the distress. Okay, so self-rumination undermines the health and the well-being, and it is one of the common risk factor for somebody to get depressed. Okay, so self-rumination is something which is a known risk factor for getting depressed in multiple people. So reflecting on negative experience could take two forms. Okay, so when I mean negative experience, it could be something in a memory, okay, or something which is happening now. Okay, so in an experimental fashion, you can bring about the reflection on a negative experience, usually by invoking some negative event from one's own memory. Okay, so it could be that death of somebody who an individual life, or it could be an interpersonal issue. So it could be some conflict with a partner. It could be an event in which the person underwent either an emotional or a materialistic loss. Okay, so or it could be an experience which was disgusting to the individual. Okay, so whenever somebody has to reflect upon their own experience which was of negative in nature, okay, people usually take two forms. Okay, so one of them is known as the self-immersion. Okay, so in self-immersion, the person visualizes negative events happening all over again. Okay, so it's like I witnessed an accident. Okay, or I was involved in an accident, road traffic accident. Okay, so in which I was driving and the car collided with somebody. Okay, so what happens in self-immersion is the person visualizes this negative event all over again. So it's as if you are again looking it through your own eyes, the whole event. Okay, so what this reliving results is it causes a lot of emotional arousal, and it also makes it difficult to reason out objectively. For example, if I was involved in a conflict with my partner, or if I was involved in a conflict with my coworker, okay, and I just go back and then start reflecting about that event, okay, I get agitated again that why did that person do like that, or why did that situation ended up like that. Okay, so that results in a lot of emotional arousal, and whenever there is a lot of emotional arousal, it is very difficult to reason out objectively. So in self-immersion, the person is still taking a first-person stance. That is what I saw, or how did I see that situation. Okay, I'm just re-experiencing the whole thing from my own eye. Okay. On the other hand, if it is self-distancing, okay, so instead of experiencing the same thing from your own perspective, you reflect on the same experience from a distanced view. Okay, so it is not like an objectively you are going out of the body kind of an experience. It is primarily you are psychologically distancing yourself. Okay, so instead of putting your emotions, okay, you are trying to reason out like what was the reason for that situation, okay, or how else that situation could have been handled. Okay. Whether my behavior during that situation was appropriate or not, whether the other person's behavior was appropriate or not, whether the other person had some justifiable reason to behave like that. Okay. So it's like you distance yourself psychologically. So whenever you distance yourself psychologically, it is emotionally calming rather than it is emotionally arousing. Okay. So you look oneself as something like a fly on the wall. Okay. So this helps you to um, reason out things in a constructive way. Okay. So it is something like you're seeking out counsel from a friend. Okay. So rather than looking at things from your own perspective, you're actually seeking counsel from a friend. Okay. So this is what is the distancing when it comes to the self. Okay. So to put them together, okay, the self perspective could be a self immersed or it could be a self distanced. So in self-immersed, you are actually reliving or recounting the experience. You are not reconstruing the experience. On the other hand, in self-distancing, you are reconstruing the experience and you are decreasing your recounting or recalling the experience. Okay. So in short term, what it results is while self-immersion results in worsening of your negative effect and enhancing the stress response or the emotional arousal, self-distancing actually decreases the physiological stress and it also emotionally calming. It decreases the negative effect. Okay. So the long-term outcomes are diagonally opposite. Okay. So in self-distanced, you will actually have decrease in the emotional reactivity and you will also become less vulnerable to these recurring thoughts or the ruminations. On the other hand, if you're doing self-immersion again and again, you become more vulnerable to the same recurring thoughts and the rumination, and you also become more and more reactive emotionally. So the reasoning part goes down and the emotional part comes up if you are doing only the self-immersion most of the time. Okay. So what are the behaviors suggestive of self-distancing? Okay, so some of the common examples are if you take the adaptive self-distancing behavior, which you see, what the Buddhist monks have been practicing, so this is called mindfulness practice, in which you adopt a self-distance perspective to simply observe and accept one's own feeling. Okay, so you distance yourself from your feeling and you start looking at it from an objective way, and then you accept your own feeling. Okay, so you accept the feeling, you accept the thought, you don't react to the thought from a first person perspective. Okay, so this is the common principle of the mindfulness based practices. At the same time, sometimes the self distancing could become maladaptive. Okay, like I was telling in post traumatic stress disorder, in which you consciously start avoiding about the emotional content of the experience. Okay, so whenever this is the common theme of avoidance rather than reasoning kind of a self distancing, okay, then the same event can again come back and result in self immersive experience. Okay, so that becomes a maladaptive kind of a self distancing. So if you are avoiding rather than reasoning, even though it is self distancing, it becomes maladaptive to one. So the self-distancing could be induced, self-distancing could be spontaneous. So what I mean by induced in this case is either it could be experimentally induced in a given setting, okay, or in a clinical setting, it could be influenced by the therapist or the patient. So the therapist can help the patient to learn to do self-distancing and then to come out of the emotional issues that the patient is dealing with. Okay. So let us look at the induced self-distancing first. Okay, so in experimental situation, how this induced self-distancing is done is you ask the participant to recall an experience which was overwhelming and it was negative. Okay, so it could be anything from their memory. It could be from a short-term memory or it could be from their long-term memory. Okay, and then once they recall that event, okay, then you give a cue, okay, which would suggest them to follow self-distancing, or you could suggest them to follow a self-immersive kind of a strategy. Okay, So I will show you the example of what kind of an instruction will help an individual to follow this, and then you can see the outcome in terms of a behavior. Okay, so to see whether self-immersion is good in a given scenario or self-distancing is good in a given scenario. Okay, so for example, if you want to induce self-immersion in an individual, okay, so once the person has recollected their own uh, negative or overwhelming experience, okay, so you can give them an instruction that you go back to the time and place of the experience you just recalled and see the scene in your own mind's eye. Now see the experiencing unfold through your own eyes as if it were happening to you all over again. Replay the events as if it unfolds in your imagination through your own eyes. Okay, so these are some of the instructions which are also commonly given when somebody is trying for either a self hypnosis or an induced hypnosis. Okay, so you primarily give a strong suggestion, okay, and then make the person to immerse into this negative experience. Okay, on the other hand, if you want to push the person towards a self-distancing strategy rather than an immersion strategy, the initial instruction remains the same. Okay, so go back to the time and place of the experience you just recalled and see the scene in your mind's eye. Okay, but then instead of experiencing that event, you ask the person, now take a few steps back, move away from the situation to a point where you can now watch the event unfold from a distance and see yourself in the event. As you do this, focus on what has now become the distant you. Now watch the experience unfold as if it were happening to the distant you all over again. Replay the event as if it unfolds in your imagination as you observe your own distant self. So the difference between self-immersion is one is not seeing their own self in self-immersion. Okay. So it's only the other person who will be visible even when somebody is recollecting the event. But in self-distancing, in addition to seeing the person will be able to see oneself. Okay, so this may not happen immediately in the first setting, but with practice and with repeated administration, it is still possible to distance oneself from the emotions associated with the event and then start looking at it from a third person point of view. Okay, so then you go back and ask them. Okay, so once they have done this exercise, you go back and ask them what did they feel and what were the thoughts that they had. Okay, fine. So you ask them to recollect the stream of thoughts that came. Okay, so in both these experimental scenario. Okay, so in immersion, it could be something. So let us take, for example, it was a relationship breakup. Okay, so that was the negative event the individual recalled. Okay, and then the individual says that I was appalled that my boyfriend told me he couldn't connect with me because he did not think our interests match. Okay, so the person may say that I cried and sat on the floor of my dorm hallway and tried to prove to him that we can still work it out. Okay, so this is what actually happened during that incident. So the person is trying to recollect the whole incident, okay, and reliving that. Okay. On the other hand, if you are actually asking the individual to do self-distancing, okay, the stream of thought could be something like, I was able to see the argument more clearly. Okay. I initially empathized better with myself, but then I began to understand how my friend felt. Okay. So when you're having a first person account, there is very little of how the other person felt, but it will be more like how I felt, because whenever you have an overwhelming emotion, you will not be able to look at what the other person is experiencing in a better fashion. Only when you take a step back and then start looking at it from a third person point of view, that is when you will be able to look at that what the other person also might have felt. So it may have been irrational, but now I understand why the other person did like that. Okay, fine. So the advantage of self-distancing is instead of arousing the emotion, it actually results in a catharsis of the emotion. So it will be an emotionally relieving kind of an experience. Okay, so it will be emotionally calming. And whenever somebody follows a self-distancing kind of an approach, okay, there will be closure to this conflict. In self-immersive kind of an experience, the closure doesn't happen, but the negative experience actually becomes more and more strong. In self-distancing kind of an approach, the negative emotions actually start losing their arousal power, and then they start becoming more and more calm. Okay, so this is an experimental evidence for the immersion versus the distancing kind of a strategy if it is used. So as you could see, if somebody follows immersion, the negative valence of the emotions are high. Okay, so it is like somebody feels sad or anger. Okay, so if they had felt that in their previous event, okay, so which they are recollecting now, they again feel it more. On the other hand, if somebody is following a distancing kind of a strategy, then the intensity of the sadness or the anger will be less. And if somebody can do this on a regular basis, then it starts losing the intensity even further. Okay. So one other strategy which people get confused with self distancing is what we call as distraction. Okay. So for example, you had a fight, now you go for a run. Okay. So people say that I needed some time myself, so I went for a movie or I went for a run. Okay. So no doubt, the negative feelings usually come down whenever somebody is distracting themselves with another activity. Okay. But the difference between the distraction and the self-distancing is that in self-distraction, the negative feelings will return once the distraction is stopped. Okay, so and second thing is it actually requires an external stimulus to get distracted. So whenever the external stimulus is stopped, okay, the distraction is stopped, the same emotional reactivity will come back. Okay, there is no closure to the conflict in distraction. Okay, so in other words, it is more like a temporary solution. Okay, so once you stop doing that activity, it actually comes back. The worst thing is sometimes it comes back with vengeance. It comes back actually with a little more intensity than earlier, because you had suppressed it all this while by doing some other activity. Okay, so self-distancing will have a long-lasting effect, but the self-distraction will have a short-lasting effect. In self-distancing, the same negative effect does not return, but the negative experience returns in distraction once the stimulus is stopped. Less emotional arousal in subsequent recollections with self-distancing, whereas in distraction, the same arousal comes back. There is closure in self-distancing, but there is no closure in the self-distraction. Okay. So these are some of these things are actually experimentally proven. Okay. So I have shared some key articles with Niharika, uh, which actually gives the cross references to these experimental evidences to show the difference between self-distancing, self-immersion, self-distancing versus the distraction. Okay, so this is something like an induced self-distancing, but the self-distancing could also happen spontaneously. Okay, so people may be following self-distancing as a coping strategy even without somebody teaching them. Okay, right? So, so for example, this could also be experimentally observed. Okay, so you go back to the same experiment like earlier. Okay, so you ask the individual to recollect a negative event, but don't do any manipulation, don't give any instruction. Okay, just ask them once they recollected, ask them the stream of thought. Okay, and how did they feel when they recollected. Okay, so rate the extent of immersion versus distraction and distancing. So people will be following self-distancing by themselves, even if it is not something which is formally taught to them or they have practiced it. Okay. So one good part is if it is something which is inherently present in an individual, they usually have lower levels of negative effect, they have lower levels of rumination, and they are able to handle stress in a better way when compared to somebody who has self-distancing, who doesn't have self-distancing as a regular coping strategy. Okay, so this is something which is seen in regular community. Okay, of the spontaneous self-distancing. Okay, so many people have, and these people are also less vulnerable to develop a clinical depression. Okay, so what are the behavioral implications if somebody is following self-distancing as the main strategy? Okay, So from the clinical point of view, as a clinician, for us, what's very important is we also need to see that some of these cognitive strategies actually result and translates into a behavioral modification. Okay? Because at the end of the day, you need to be able to bring about change in a person's behavior. Okay, so this strategy is very useful to decrease aggression. Okay, so the aggression or the violence could be in verbal or sometimes it could be physical also. Okay, and it is very commonly seen in interpersonal relationship context. Okay, so for example, domestic violence. Okay, this is something which can be handled if somebody is ready to put their time and do self-distancing as a strategy rather than self-immersion. Okay, and this over a period of time, this could also become a spontaneous self-distancing strategy. Okay, so this will be helpful in better conflict resolution, lower hostility. Okay, so for example, even if the mistake lies on the other person, if somebody can follow a self-distancing strategy, it has been shown that they will have decrease in the hostility towards the other person, and also they may punish the other person less. Okay, so this has been examined in experimental fashion, in which people who have high social self-distancing as a strategy actually give less punishment even if somebody makes a mistake compared to people who have low self-distancing strategy. And not only in disease condition and not only in negative conditions, if both parties can follow self-distancing, it actually results in better interpersonal relationships. Okay, because you put your emotions down, okay, and take a step back and start looking the situation from the other person. Okay, so it's like you start walking in other person's shoe as well. Okay, and then start looking your position from the other person's point of view. So what are the clinical implications? Okay. So what we follow is something we call it as cognitive therapy. Okay. So for example, if somebody comes with an anxiety problem or somebody comes with a depression, okay, so you go back and start looking at what is the strategy that they follow whenever there is a conflict. How do they resolve the conflict? Okay. Or what is their coping mechanisms to handle stress? Okay. So what is making them vulnerable? Okay, many times we identify that instead of self-distancing, either they will be following a self-immersion or they will be following a self-rumination kind of a strategy to deal with the negative experience. Okay, so cognitive therapy actually helps the individual to distance themselves out from the negative experience and then reflect upon their own behavior and also start looking at the other person's behavior and try to resolve the conflict which is resulting in the depression or the anxiety or the other neurotic behavior. The second application is in mindfulness based therapy, because the whole principle of mindfulness is you be a passive observer to your own thoughts and feelings. Okay, so mindfulness based therapies are helpful not only for people who have emotional issues but also to make oneself better. Okay, so to improve oneself as well, even in healthy individuals, mindfulness based meditation practices are definitely helpful. Okay, so these are some of the clinical applications. I will get into some of the clinical scenarios and try to link how self-distancing, self-immersion, self-rumination may interplay in a clinical scenario. So when we take a patient with depression, they usually have increase in rumination. Okay, so rather than self-reflection in the form of a self-distancing, okay, or in a constructive self-reflection, they usually have self-rumination as the predominant strategy. And people who have learned self-distancing as a strategy, they usually have decrease in the severity of the depression. Okay, so if this is a spontaneous self-distancing as a trait, their personality trait, then they are less vulnerable to develop depression. If it is not their personality trait and they develop the depression, even after that, if they start doing self-distancing as a strategy because of cognitive therapy or by mindfulness based, it has been shown that there is going to be decrease in the severity of the depression. And the most important thing is also that it may also help to prevent the next episode of depression. Okay, because the interpersonal conflicts are not going to end throughout the life. Okay, so one or the other kind of a stress is going to come, one or the other kind of an interpersonal conflict will be coming in an individual's life. So the self-distancing strategy actually helps not only in treating the depression, but also in preventing, because there will be less negative effect after analyzing these memories in the future as well. Okay. On the other hand, the post-traumatic stress disorder is an example for maladaptive self-distancing. The maladaptive self-distancing comes in the form of an avoidance. So the observer, instead of trying to reason out and looking at the whole scenario from a constructive aspect, they start observing the whole experience in an emotionally numb environment. Okay. So instead of putting your reasons behind, what happens in PTSD is the person starts looking at the whole event from a third person. They are reliving the experience, but not from a first person, but from a third person, because it is so emotionally arousing that the person cannot tolerate the emotions, so they distance themselves and they experience something what we call as derealization or depersonalization. Okay. So instead of it is something like you are immersing actually yourself, but from a third person point of view. Okay, so instead of experiencing and not looking at the reasons, the person will be just looking at the event from a third person point of view. Okay. So in such scenarios, instead of avoidance emotionally, one needs to look at the whole event and try to reason out, okay, and then stop the avoidance. Okay, so if somebody is actively analyzing the event instead of just recalling the event, their own negative experience will decrease and it will help in resolution of the traumatic memories. Okay. So this is again cognitive behavior therapy of PTSD is based on the same. Okay. One other example of clinical application of self-distancing is studies have shown that if somebody has a self-distancing as a strategy, okay, their blood pressure levels are better maintained. So in individuals, because self-immersion and the distraction usually results in more autonomic arousal. More the autonomic arousal, it actually results in sustained increase in blood pressure. Okay. So people have shown that in addition to the medications, if somebody can be taught either mindfulness based or the cognitive therapy, so that you start doing self-distancing as a strategy, they have a better stress tolerance and they have a better maintenance of their blood pressure. Okay. So the neural correlates of self-distancing, again, this is just a glimpse. People have done functional MRI studies and tried to look which areas of the brain become, which areas of the brain actually changes in the activity while somebody is self-distancing versus self-rumination. Okay. There is and studies have shown that reduced activity is seen in the brain regions of SSA, insula, and amygdala. These are the emotional brain regions, which are usually more active when somebody is depressed and having self-rumination. Okay. So it's not only that you see changes in the behavior, you also actually see biological changes if somebody can follow a self-distancing as a strategy. Okay. So just to summarize, self-distancing is an adaptive form of a self-reflection. On the other hand, self-rumination or avoidance is a maladaptive kind of a self-reflection. So self-distanced perspective is better than self-immersion kind of a self-reflection. Self-distancing can influence how one think, feel, and also importantly, how one behaves in a conflicting situation. So it can be both induced in experimental or clinical scenario, and over a period of time with practice, this induced can become spontaneous as a trait for real life applications. It benefits both health and disease. Okay. And I guess if at least I was able to give you some glimpse into the distance self from a clinical point of view, and some of the clinical applications. But I'll be happy to answer if there are any questions, and also I'll be keen to hear the views from other fields. What you mean by distant self?
Yeah, thank you so much, Dr. Naren. Maybe the screen share can be taken back so that we can have everybody on the center of our laptops. Niharika, yeah, thank you. Like yesterday, we would like to listen to you to share your thoughts. So please share your thoughts. If you have questions, you can put them in chat message. We can send it to Dr. Naren because he has emergency. He may have to leave very soon. As you know, he works in the hospital, so he's more needed there than with us. So please, if you have questions, let's share them as soon as possible. Or if you would like to email them, or you can put them in the WhatsApp group as well, which we all are there.
I still have another 15 minutes, so I'll be keen to hear from others.
All right. Yeah. So would you like to share your thoughts? Anything which you think is very profound, at least personally for you, which you would like to share? Or would you like to raise a question? I hope we have not gone into a deep self-distancing silence.
Two people have raised their hands.
Yes.
If it's for a question, you can please unmute yourself and speak out the question.
I think Mr. Krishna has. He's
and
unable to unmute. Have you? Can you? I think he is unable to unmute.
Yeah.
Hello.
Yes.
Can you hear me?
Yeah.
Okay, Dr. Naren, thank you so much. I'm actually an MBSR and MBCT instructor, so I can connect with you very well. I wasn't sure if these therapies are being brought into people who need it in large scale, because most psychologists or psychiatrists today are not practicing these therapies. And I was just wondering, would it make a difference if they started practicing it? And if, say, we brought it to schools as well?
Yeah. I agree. See, it is usually easy to modify a visible behavior than change some of the cognitive aspects which are not visible. Okay. So many people resort to behavioral modification as a primary strategy because it has a materialistic output. Okay, so you can see something as a change, then it actually makes that the outcome is good. Whereas the self-distancing or any other form of a cognitive change is actually not something easy to measure. But I completely agree with your point that it's very important. There are many psychologists and psychiatrists who are practicing both cognitive and mindfulness-based therapies, but in selected populations. Okay, so one major reason is also that these are not something which can be done in a single session like lay counseling. Okay, these actually require quite a bit of time-intensive, one-on-one, okay, long-term commitment from both patient as well as the therapist. Okay, so that may be the reason that it's not something which is practiced in school-based settings or in lay counseling settings. But if somebody is trained and ready to invest, I definitely think that it's highly pertinent that they should start using this form of therapy.
Mr. Abhishek Tripathi has a question, so you can unmute yourself and speak. Mr. Abhishek Tripathi?
Yeah. Hello.
Yeah.
Yeah. So thank you for your presentation. So my question was on mindfulness-based therapy. Actually, as you said that this could be a remedial way of treating in some emotional regulations. But I think on a philosophical perspective, I want to raise this, that some of these centers who conduct these Buddhist meditational practices like Vipassana, in recent times, they have not admitted people who have, like, I should not say severe, even the slightest issues of depressions or emotional regulations. Then there is a conflict that how it, I mean, at what level of self-distancing people should take such remedies or such, helps. So do you have any thoughts on that? I want to understand. Thank you.
Uh, yeah, very good question. We see the same trend not only with mindfulness based, but also with other forms of complementary and alternate medicines. Okay. See, the problem is possibly because of two factors to my mind. One is that people call all kinds of psychiatric disorders as depression. Okay. Uh, One of the reason is that depression is one illness which is not stigmatizing. Okay, the other person actually feels more empathetic and sympathetic if somebody is depressed versus somebody if they say that they have some other kind of a psychiatric problem. Okay, so there are conditions, for example, psychosis. Okay, in which their self perspective is very fragile. Okay, so in such conditions, if somebody is doing an intense kind of a therapy, it could be counterproductive in some time. Okay. So one reason why some of the alternate medicine centers simply refuse anybody with psychiatric issues is that they would have had some bad experience, because we see some patients with psychosis who go to the Vipassana meditation and then worsen and then come back. Okay. To the treatment center. That may be one reason. The second issue which you raised is that uh, whether the severity of the illness has anything to do with the application of the therapy. Okay.
Yes.
So when we call something as depression, the depression could be because of pure biological reasons. For example, it could be a severe hypothyroidism. Okay. That could also manifest as depression, versus something which could be pure psychological reason. Somebody had a relationship failure which is actually resulting in depression. Okay. So the strategy need to be decided based on the reason for the depression. Okay. So if we are trying to apply pure cognitive strategy in a pure biological scenario, it may not work. Okay. So rather than severity of the depression, it is actually the type of the depression which becomes important. So it is preferable that they at least have one consultation with the psychiatrist, so that the psychiatrist will be able to tell whether it is mainly of psychological reason they would be better suited for therapy, versus they are somebody, this is somebody who actually requires a biological form of a treatment.
Thank you.
Otherwise, any form, severity of the depression, if it is psychological in nature, could be handled by therapy.
Thank you.
There are more questions. Please unmute yourself. I see 3 people have raised their hands. Can you please unmute yourself and speak?
Greetings, sir. Sir, as you said about spontaneous self-distancing do wonders. What is the probability that the person who is already in trauma wants to recall that incident without being any instruction provided?
Yeah, see, if somebody is has this as a trait, inherent trait, that they're able to distance themselves and reason out the experience. Okay. So everybody will have the ability to recall. The challenge is not to get into an immersion, but to actually distance yourself. It's easily said than done. Okay, because emotions are not completely under our control. So it will require some amount of practice if it is a traumatic experience. So if the trauma was very severe and the person was not able to cope up with that trauma in the beginning, okay, I would suggest that it may be good to undergo the self-distancing experience with supervision, at least in the beginning, so that they don't actually decompensate further by getting into immersion. If they are able to do that over a period of time, definitely the salience of the trauma and the negative effect associated with the trauma would decrease if somebody is able to practice the self-distancing.
Uh, Next question.
Nuzhat here. So my question is, like, when there are two people involved, one person is full of guilt and the other person is involved in a kind of self-imposition, and so there is a kind of self-rumination, and both the people get apart from each other because of that. And the other aspect of the behavior is also like, one is very involved into the sexual activity, the other doesn't want to get into the sexual activity or something like that. In these kind of scenarios, what is the best solution so that the relations don't break apart or something like that?
Yeah. See, the self-distancing may not solve the problem. It may resolve the inner conflict, okay, of what I should do or what did I do. Was it good, right or wrong, or was it valid or not? Okay. Because sometimes there may not be right or wrong. Okay. Was it something useful behavior or not? Was it something which was valid behavior or not? Or am I uh, was it acceptable to me with my self-representation or not? Okay. So whenever there are two people involved, okay, so if both of them are able to distance themselves, then the chances of conflict resolution is better. If one person is not able to do that, the one person is continuing with a problematic behavior, the other person, if instead of getting into self-immersion, if they can do self-distancing, they may be able to identify that the problem lies with the other person, but that problem I am reacting in a way in which it is compounding the problem. Okay. So in that way, it may help to resolve the conflict. It's like if you are in a negotiation table and one party is actually very adamant not to compromise. Okay. Instead of just continuing the argument, you may be able to realize that there is no point in further continuing this argument. Okay. So things like that. So in short, if I have to tell, well, if you do self-distancing, you may not solve the problem if the problem is because of the other person. But it could bring about resolution to a conflict one is facing within themselves.
Sure. Thank you.
Sir, can we take, there are two more questions. Can we take them? Or
Yeah.
yeah, Mr. Rudresh, you raised your hand. Can you please speak up?
So, this is Rudresh, and actually in the yogic practice, we do introspection for eradication of worries and other self improvement for that. So in that, if we involve, it mainly analyzing the thoughts we do. So in that, if we, I think mainly due to immersion, the results will be very slow. So how to adopt self-distancing if we can?
Yeah. So introspection would involve the self-reflection part. Okay. But what happens usually is once you start reflecting on an event, it automatically results in immersion. Okay, because if the emotions are strong because of the negative experience in the past, it would result in an immersion automatically. So it requires a conscious effort that you take a step back at that moment, because by default your mind would go to immersion because emotions are more primitive and they may be more overwhelming, and then comes the reason. So it is important to take a pause at that stage and then to take a step back, and then you will have to start practicing looking at the whole event from an outsider point of view. Okay. So this would help regardless of the kind of practice that you're doing. The principle remains the same. The techniques may be different in how you want to stop the immersion and shift over to the distancing part, because it could be concentrative strategy some people use openness kind of a strategy. Okay, so different kinds of meditative practices are there even within the mindfulness based practices. So regardless of the strategy technique that you use, the principle remains the same, that instead of getting into an emotional experience, you will have to come out, take a step back and look at that from a cognitive perspective, that you reason out rather than experiencing emotionally.
Sir, there's one more question by Sindhu Shri. Can you please speak up?
Yes. First of all, Naren sir, thank you very much for this very intriguing talk. My question was, or more of a comment was on this distraction, self-distraction concept you mentioned, which is on point for many aspects of life, because we hear this phrase quite often about time heals. How you know, many times we have been advised to say, it's okay, just let it go, the time will heal. In many cases, it is a survival instinct as humans that our brain tends to erase certain facts of an experience to just to cope up, to just to be able to move on and to be stronger. Wouldn't that also be a good strategy? How harmful do you think that is to do that quite often, to do that over and over again? That you just keep telling yourself, okay, it's okay, this will, you can move on, keep, or to advise others.
Yeah. See, this strategy may not work in all scenarios. So there is a threshold. So, for example, you go eat your breakfast in a restaurant, the food was not good. Okay, there is no point in ruminating about that throughout the day. Okay, so you ignore that and then move on. Okay. On the other hand, if you have a break in a relationship, okay, the threshold of the intensity of these two experiences is not the same. Okay, so the same strategy would not work. Okay, in scenarios in which the experience has caused more emotional arousal. So if the scenario doesn't cause a lot of emotional arousal, then you may not require a conscious strategy to do. But if it has resulted in a lot of emotional arousal, then the distraction, avoidance, those things usually don't work. Okay, it requires a resolution. Okay, so the conflict need to be resolved, and those are the scenarios in which you need to consciously practice some of these strategies.
Thank you, because this is something that has to be advised to even the, you know, the older generation, or even professionally as your bosses, as leaders. That is something which is necessary, that they don't use such terms to say, it's okay, move on, you will be fine. But thank you. That was a...
Welcome.
As we are nearing the class, I would request Professor Sangeeta Menon to say a few words for Dr. Naren. And I will share the presentation and the resource material that Dr. Naren has shared with me on the group. If it's okay, sir, can I also share your email ID with the host participants?
Yes, no problem.
May I request Professor Sangeeta Menon to say a few words?
Thank you, Niharika, and thank you, Dr. Naren. We have been discussing various aspects of the lockdown last afternoon as well. So this talk on self-distanced self has added more depth into our thinking, and also perhaps more possibility of reflecting upon our experiences in the coming days. And I have to also tell you that Dr. Naren and I are planning to bring out an edited volume with the chapters based on the lectures you would have in this course lecture series. So you would hear more from us perhaps in the coming months, because we thought that these 9 dimensions are very important. That is, so that it's brought out towards more of public engagement. I'm sure you would have a lot to ask and a lot to share with Dr. Naren, but we will let Dr. leave now. And I'm sure he would have a very busy schedule waiting, being in Imhance. So we are hoping that we can continue our engagement with him, and you would have more questions. You can raise it in the WhatsApp group or email it to Niharika or me. So thank you, Dr. Naren, so much, and we will be in touch.
Sure.
Thank you so much for your time and your
My pleasure.
patience.
Thanks for inviting me. Yeah. Glad that we could touch again. Yeah. Thank you.
And thank you all.